have a 2-year fellowship program that's very clinically oriented. We have 1 fellow per year, and we have 8 faculty, so we have a good faculty-fellow ratio. And our aim is to teach our fellows how to see and manage patients with rheumatic diseases.
Rheumatology is a specialty where we have multi-system involvement, so we have involvement of other organ systems. It's not just limited to the joints. Sometimes we have to involve other specialties like neurology and nephrology based on what the clinical situation is.
So I was drawn to rheumatology by the complex problem-solving, multi-system nature of the subspecialty. I think that rheumatology as a subspecialty kind of nicely encapsulates the concepts of benchtop to bedside medicine. And a lot of the patients that you look after have got chronic conditions, so you get to build long-term relationships with them.
We serve the entire state of Vermont and northern New York. So we probably have a catchment area of a couple million people in terms of the population we serve.
The diversity of cases is growing, and we have a large immigration population. So we have more cases of lupus, vasculitis. We do see a lot of osteoporosis, osteoarthritis, rheumatoid arthritis.
So we have a very well-rounded fellowship program. We nicely balance education, clinical skills development, and research. The faculty here are all absolutely outstanding.
We only have 2 fellows, and there is a high faculty to fellow ratio, so the fellows get exposed to a wide variety of practice patterns, and the fellows get a lot of attention from the faculty, plenty of supervision, and a lot of opportunities to do procedures, including ultrasounds, but also, of course, aspiration and injection of joints and tendons.
We included musculoskeletal ultrasound in our Rheumatology Fellowship curriculum, and we were one of the early adopters to fit this into our curriculum. And musculoskeletal ultrasound is a new skill that many new rheumatologists are trying to learn. Our fellows get to rotate and train with us in our dedicated musculoskeletal ultrasound clinics. We have a dedicated ultrasound clinic multiple times a month, and our fellows get to learn both diagnostic and interventional ultrasound procedures. Most fellows who have trained with us have continued to use musculoskeletal ultrasound in their clinical practice, and some of them have also gone on to establish their own musculoskeletal ultrasound clinics.
There's opportunity for our fellows to be involved with research, either actively in the lab itself or a little more peripherally and simply attending our conferences to learn immunology. And we also offer didactic lectures and courses to not only rheumatology fellows but other fellows that need to learn immunology. So there's a lot of opportunity there for our fellows to learn the basic sciences they need behind our diseases. I think it's really important for all fellows to get well grounded in the molecular principles behind their diseases. And that's what our center can provide. With the research that we've got going on, we can give a very firm background in principles of immunology that are fundamental to our diseases in rheumatology. My role as a mentor, I think, is to help them find a passion. Nothing of significance comes about in this world without passion. And I think to really make headway into understanding our diseases, you really have to be passionate about it.
Because the program is small and the division is not a huge division, I think that it has a family atmosphere. People are very supportive. We work as a team, not just amongst the physicians, but the allied health professionals, including the nursing team, our clinical pharmacist, our pre-authorization team, infusion center. All of these people come together to work as a team to take care of patients, and we get to know each other very, very well.
I want fellows to be excited by what they're doing and what they're seeing, and there's so much to be excited about in our diseases because there's so much to learn.
I never even considered doing a fellowship somewhere else. I think that the world-class quality of the faculty here, the supportive nature of the faculty, they're all so incredibly approachable. and the balanced nature of the program with kind of clinical skills and education, research, ultrasound, I really couldn't kind of think of a better place to do my fellowship.
I hope you'll consider applying to our program. We have wonderful people here. We have great patients who we love to see. We build great relationships among each other and between us and the patients. And I think that we have all the things that are necessary for a person to become a great rheumatologist.